And good afternoon, everyone. Thanks so much for joining us for this Wednesday's COVID-19 press briefing. We certainly appreciate you being here with us today. Today, Mayor Demings will discuss our COVID cases, positivity rates, and the number of those who are sadly deceased due to this pandemic. The mayor will also offer some good news on gene copies per liter in our wastewater. And in this conversation, the mayor will discuss testing, the importance of vaccinations, and where you can find them both. Dr. Yolanda Martinez, the director of the Orange County Health Department, will brief us on county activity as it relates to the pandemic. Barbara Jenkins, the superintendent of schools for Orange County, is here with special updates. And last but not least, Comptroller Phil Diamond will report on tourist development tax collections. We will begin with Mayor Demings. Mayor?
All right, thank you, Dr. Williamson. This morning when I got up, I looked at the news and Al Roker was on, and he said, good morning, it's Tuesday. So welcome to our Tuesday press conference. 2-2-2-2. Perhaps all of you got that. This morning, the other anchors didn't. They said, today is Wednesday. But in either case, it's also Groundhog Day, and that means that we have 6 weeks of winter that's left. Here in sunny Central Florida, that may mean something different than what it would mean to those who are in the Northeast or the Midwest or other cold climates. But thanks to Punxsutawney Field. Is that the way you say it? Close. Yeah, what can I say? Dr. Williamson wanted me to say that. But this is our 171st news conference since the pandemic began, and the first since January the 12th. Of course, many of you know that during that period of time, unfortunately, I even tested positive myself, but I thank God that I had a mild form of COVID. I really didn't have any symptoms, so I was able to continue my work from home and get back to work in person within just a few days. So I'm glad to be back. That really signifies just how the Omicron variant was moving throughout our community. It impacted many of our co-workers here with Orange County government and continues to impact our workforce as well as throughout our community. But there's some good news that we'll share today with you. I hope the news that we share is more good than bad. The Florida Department of Health in Orange County elect to send a representative today. You can only fill in the blanks there. Why? There's no representative here. But what we have been told by the local Department of Health is that Orange County now has 365,411 positive cases of the coronavirus reported. The number of Orange County residents who have passed from COVID-19 since the start of the pandemic has now increased to 2,436. During the month of January, the first month of this year, 112 of our residents have been reported to have died of COVID-19. That's a significant number for many reasons. That was the deadliest month for COVID here in Orange County since October. Our 14-day positivity rate is now 25.8%. At one point, I would have thought that that was a terrible number. It's a bad number, but it's much better than it was. That is down 15 points from our last briefing on January the 12th, when our 14-day positivity rate was 40.79%. Again, according to the Department of Health, the percentage of residents ages 5 and older who have had one or more shots of the vaccine in this county is now at 75%. You may remember also that back in December and mid-January, we had record-setting results in the number of COVID-19 gene copies per liter in our wastewater system. due to the spread of the Omicron variant. Omicron continues to be the most prevalent strain in our community, but the numbers are declining. The good news, the latest numbers we have are from Monday's testing. The Northwest Reclamation Facility, that on that day it was reported that we had 10.2 million in mid-January, and that has now dropped to 847,600, which is a 93% decrease in the gene copies per liter in our wastewater system. Our South Water facility had $3.5 million just back to mid-January. It is now down to 633,400, which is a 90% decrease from last month. The Eastern facility was at $5.5 million, and our last briefing, that number now has dropped to 1 million, which is an 84% decrease from last month. So that's good news. We have representatives here from our utilities division if you have additional questions. In terms of the testing, we have continued to provide free testing here within Orange County. Barnett Park is still our busiest location. The other two sites are the Econ Soccer Complex and the South Orlando Youth Complex. Each site opens at 9 a.m. daily, and they continue to provide testing until 5 p.m. They conducted a total of 5,000 tests on average each week. Our health services team, we have Dr. Yolanda Martinez, who's here with us today. She can help fill in the blanks on information there. If you need more information about testing sites, you can go to ocfl.net/testing. Remember that the City of Orlando's Camping World Stadium is also open 7 days a week and will be operating through the end of February. Barnett Park remains the only Orange County run site that also provides vaccinations. Anyone 18 years of age or older can get the vaccine between the hours of 9 a.m. and 5 p.m. each day. On the weekends, the children's Pfizer vaccine is available at Barnett for those between the ages of 5 to 11, and a legal guardian must be present with the children. If you can't get to Barnett Park, there are other locations where individuals are also eligible to receive the COVID vaccine here within Orange County. To find a vaccination site near you, we ask that you go to ocfl.net/vaccine sites, or you can simply go to vaccines.gov. The mask mandate in our buildings remains in effect for Orange County employees, and right now we have 80 employees that are out due to COVID. None of them, I'm happy to report, are hospitalized. That is down significantly from last month, where we had nearly 400 employees with the coronavirus. And I'm going to shift gears now and talk about National Wear Red Day. That will occur this coming Friday. In addition to February being Black History Month, it is also Heart Awareness Month. On Friday, it will be the National Wear Red Day to help promote cardiovascular health for women. And so I'm wearing my pin here today in solidarity with the Heart Association's goal of eradicating heart disease and stroke in millions of women nationwide. I hope our residents will wear red on Friday and show their support for this awareness campaign. And now I'd like to call on Dr. Yolanda Martinez from the Orange County Health Services Department. And if you have any questions, by the way, in Spanish, when I'm speaking, we have Ms. Yesenia Negron, who's joined us today. Dr. Martinez is fluent in Spanish as well. All right.
Thank you very much, Mayor, and good afternoon to everyone. And I wanted to echo the message from the Mayor earlier that the numbers for COVID seem to be improving. And it's evident also through our testing sites. The demand for testing has decreased tremendously over the last couple weeks. So we're happy to be able to still assist the residents through the testing and the vaccines. But we know we gauge more or less the need in the community when the numbers start increasing there. And as a matter of fact, when we look at positivity rates in our sites, it's always a good thermometer for what is happening by the numbers that are reported by the health department and positivity in the county as a whole. So I also wanted to mention, and I wanted to thank the mayor for wearing his red dress today in the pin, that is the pin, in solidarity, as you mentioned, with Heart Health Month. We are in February. February is Heart Month for a variety of reasons, but the first Friday of every February celebrates the National Wear Red Day for the community, and it's a way of bringing awareness to heart disease, which, as many of you, hopefully all of you know, it's the #1 killer or the leading cause of death for both men and women. And the reason for the dress is that while heart disease has usually been associated as a male disease, it also occurs in women, and women don't usually pay attention to it, but it is important to pay attention to it. So wear red, and some of and heart disease is a preventable disease. I know all of you hopefully know that, and there are many steps that we can take to prevent heart disease. Amongst them is not smoking, and if you smoke, stop smoking, and you can see that the decrease in the rate of the heart disease is very rapid when you stop smoking. Physical activity, engage in at least 30 minutes of physical activity a day is very important. A healthy diet, eat healthy, lower fats, lower sugars, low carbohydrates, and that will help you maintain a healthy weight. Also, get good sleep. Good quality sleep is important in our very busy lives nowadays. We forget that we need to shut down our brains for a little while at night so that our bodies and our brains can regenerate and give us the strength that we need for the following day. And along that, managing stress is very important. And I know that we're living very stressful times, and we have gone through 2 years of lots and lots of stress. Hopefully, a time will come soon when we will begin to decrease the level of stress, and our lives will improve and our health that way. And then finally, get regular health screenings. That is very important because that is what it tells you how your system is doing. And related to that, I wanted to mention real quickly that the Orange County Medical Clinic, which is a component of Orange County government, partners with Advent Health in the Trina Hidalgo Heart Care Center, which operates out of our clinic. And that is a wonderful unit that provides cardiovascular health care to individuals that are uninsured in our community. So we have Advent Health, and partly funded by the county, that come and provide those services for our residents that do not have health insurance. In addition to that, we have 2 retired cardiovascular doctors that come and weekly provide services as well to individuals in our community that are uninsured and have heart disease. So that is a little bit of an overview of the Heart Health Month activities that we're doing. Friday, wear red if you can as a support, and I'll turn it over to the mayor. Thank you, Mayor.
Okay, we also have several of our commissioners here. Commissioner Nicole Wilson and Commissioner Maribel Gomez-Cordero have joined us also. We're going to ask the comptroller to come up, and then he'll be followed by Dr. Jenkins from the school board.
Thank you, Mayor. I'm here to report on the December tourist development tax numbers, but before I do, like the Mayor, I can't let it go without saying that, yes, today is Groundhog Day, and I know that if you saw that movie, you'd see that sometimes things feel like they repeat themselves over and over and over again. And Mayor, you might kind of feel like that after 171 press conferences. I've done about 24 or so. And as I move into the tourist tax numbers, you know, the theme of that movie was everything repeats itself. Well, thankfully, the December TDT numbers are not a repeat of last year's TDT numbers. Instead, we collected $28,244,000 in the month of December. And month over month, that was higher than November by about $3.2 million. It was higher than December of 2019 by $2.4 million. To put that in context, this December's collections were the highest December collections in the history of the tourist development tax ever. These were also the third highest monthly collections in the history of the tourist development tax for any month, period. In short, it was a December to remember. So you will see the chart, and that'll show you in picture form how our tourist taxes have done. The last number in purple, the last part of that chart in purple is December, and you'll see just how good it is. And hopefully that's a sign of things to come. And going back to Groundhog Day and what Phil said, I can't say the full name, but I know it's Phil. And but if it's going to be winter up north for 6 more weeks, that's probably very good for our tourism economy here. Moving to the tourist development tax reserve side, reserves increased by $3.1 million in December. And on a cumulative basis, since the start of this pandemic, we have used about $130 million of reserves to meet our TDT obligations. And so now our undesignated reserves have decreased from $181 million to about $51 million, a pretty substantial decrease over the course of the pandemic. Finally, we will release the January TDT figures in early March. And after the presentations are done, I'll be happy to take any questions. Mayor, Dr. Jenkins.
Thank you, Comptroller Diamond, and thanks again to Mayor Demings for inviting us to be a part to share some information with the community at large. And thanks again to him for his leadership for our community during this pandemic. A few things I want to mention for the general public. This is old news to our parents, but I will reiterate it nonetheless. First of all, we saw, as everyone is aware, a significant increase in COVID cases in 2022. Those numbers at the start of the year, those numbers have gone down significantly, exponentially, I should say, compared to January. In fact, our numbers are closer to what we had this time of year last year. We continue to monitor those cases, working with the county, the Florida Department of Health in Orange County. And you can see on our dashboard that we had, as of February 1st, 115 new student cases and 37 employee cases. Just as a point of comparison, we were up over 1,000 at the beginning of January, and so we are pleased to see those numbers coming down. You might also recall that we had mask mandatory for all of the adults on our campuses. That remains in place for the month of February as well. It is an attempt to preserve our workforce so that we can keep our schools open. At least through the month of February at this point is what we are projecting. And I also want to mention absenteeism. We, of course, in January had parents who were very concerned about the spread of the Omicron variant, and so we made provisions for excused absences as long as they were in touch with their school and completing their assignments. That opportunity has ended, and now in February, students have to come to school, attend school, unless they are sick or symptomatic or had a positive test. They need to be in school. We know school is the best place for our students to learn. We know that it's not efficient for teachers to try to manage large numbers of students absent while they're also managing their students in the classroom. We also know that February marks the official attendance period that the state will use to calculate actual attendance. Numbers have gone down. We've asked parents to come back, and they have responded very positively. Our absenteeism is back close to what we've had in previous years this time of year. We were in excess of 20% absenteeism. We are now below 9%, I believe, at last count, absenteeism for our students. Teachers as well, we have very low declined absenteeism for any of our teachers who had to be out due to the rise in the pandemic numbers. I want to remind parents, general public for information purposes, that mandatory school attendance is something that is enforced by the judge and by the court system. And so if a student is out, not communicating with their school, not out on an actual illness, it has to track toward documenting truancy at this point. Parents have another choice as well. They can certainly sign up for homeschool education and still keep their children at home if that is their preference. They just need to sign up for homeschool education as an option. I want to encourage parents. We believe our schools are best place for our students to be if they're going to learn and stay up to date with their assignments. So we'd love to see those remaining students who are able to be back in school. On a positive note, I also want to mention that we have vaccination sites. If you look on our website, ocps.net, you will see on February 2nd, 3rd, and 5th, each of those dates, we have 5 to 6 of our high schools hosting vaccination sites. I won't read through the list of those names. They are on our website. Very pleased to have 5 to 6 actual locations on February 2nd, February 3rd, and February 5th. Just to make sure, check our website. And then lastly, I would not be here in front of you without thanking, again, our teachers, our principals, all of those who are on the front lines in our schools to keep them open and to keep serving our students. We have phenomenal staff, incredible teachers who are dedicated to their work, and principals and all of our support staff as well who are dedicated to leading our students to success. Thank you for your time.
All right. Thank you, Dr. Jenkins and Dr. Martinez and Comptroller Diamond. We'll open it up for any questions that you may have at this time. And there's a microphone moving around.
Happy Groundhog Day. Puxatani, you did good. Mr. Mayor, with most of the metrics trending in the right direction, infections down, tourist taxes up, what are the county's health partners telling you? What are their concerns with the pandemic now?
I think everyone is highly encouraged by the fact that the numbers are moving in the directions that we want to see them move. But we still have a relatively high rate of infection. It's still at over 20%. So better than approximately 1 in 4, 1 in 5 persons who are testing are still testing positive. And we still have people who are hospitalized. And so we still have to be vigilant. I believe for the next few weeks, when I had a conference call earlier today with many of our local partners, the major hospitals all had representatives on the call. What they are encouraging is that we continue to be vigilant for these next few weeks, and if we do that, we should see the numbers really plateau to a level where perhaps we will no longer be placed in the high rate of transmission category by the Centers for Disease Control. We want to get back down to really that 3% level or below. And without everybody doing their part, we won't be able to get there. So we're all kind of fatigued from dealing with COVID. And as you know, there's another subvariant of Omicron that is out there. It appears to not be as critical in its impact on individuals as the Delta variant. So that's good news. I look for the good news where we can. We're going to continue making certain that for the foreseeable future, our residents have the opportunity to get tested and know their status so that they don't spread it unknowingly to others.
Potential twos question for you. First part is, the fact that DOH isn't here to answer some questions. Are you getting the access or information that you need? Because one of the questions I did want to ask is, with all these federal tests being taken inside the home, is that, and maybe it's for Dr. Martinez, is that potentially skewing the positivity rate or the amount of total cases being reported, not just in Orange County, but everywhere for that matter?
It's happening everywhere. There's no question. We still do, we're fortunate, we have a great working relationship with the local Department of Health. We have a great relationship with Dr. Pino and his entire staff. Of course, in terms of the transparency of the data that once was being made available to the general public, it's no longer being made available in a timely manner. I'll put it like that. You know, we are primarily relying on the Centers for Disease Control and the numbers that they are releasing as a result of the reporting requirements. So I wish that that was better. Are the numbers being skewed? Absolutely. Is it a concern to the epidemiologists? I don't know. I'm not medically qualified to answer that question because what I do know, there are a number of people in my sphere of friends who are using the at-home tests, and they're readily available now because the federal government has pushed out its campaign, so there are a number of ways that you can get the testing kits. And individuals who are testing positive using those kits, they aren't required to report them officially to anyone. Some may follow up and want an actual PCR test where they go to one of our testing sites. I know many people are doing that. But there's probably, at this point, when you hear the numbers being reported now, they're probably being underreported. But that is the state of affairs that we find ourselves in today with the current variant that is prevalent in our community and really across America. I think we all still have to watch, listen to those who are medically qualified to offer opinions and provide data, and there's an abundance of those that are out there today.
Melissa Thomas with Florida National News. This question is for you, Mr. Mayor. Thank you for sharing your kind of journey with testing positive, and thankfully you're here and you're okay. I wanted to ask you, with what you experienced, how has that altered your perspective, if at all, towards the county's response to COVID-19? Were there any new things that you learned from experiencing it for yourself that you probably didn't know or was aware of prior to?
Yes. I think the point in time is relative. If I had tested positive in 2020, I probably would not have had the same experience that I had in 2022. If I had tested positive in the summer of 2021, I probably would have had a different experience than I had now. So my experience has to be one that is looked at through the lens and the context of what's happening right now. And I believe that the overwhelming majority of people who are testing positive now, who are also vaccinated, I was triple vaccinated, those who are triple vaccinated incur minimal symptoms. I went a step further. Before I really got sick, I went and had the monoclonal antibody therapy done. Which of the two or any of those played a role in reducing my symptoms? Perhaps both did. Perhaps I was just incredibly blessed that I was not as sick, didn't end up with symptoms that you hear people describing. I never had a cough, sore throat, shortness of breath. I went on a 20-mile bike ride, out in the air, by myself and alone. And I had a theory that it would help me flush the virus out of my system. So, I played doctor like everybody else does. I played doctor with myself. I took control of the things that I could control. And I was able to, within a relatively short time, take a test and test negative. And so I never got to the point where I had to stop working on behalf of the people of Orange County. I would continue to work 12-hour days from home or on my computer doing virtual meetings for, again, 12 hours or so out of the day. But that's my experience. By the same token, there were people who were vaccinated who ended up hospitalized. But I think that's related to pre-existing conditions that they may have had, and maybe their DNA just was different from mine. I don't know. So when people ask me how did you do, I said this is how I fared, and I can't tell you definitively why I had the kind of experience I had. So I still encourage everybody, if you are not vaccinated, go get vaccinated, okay? You can hedge your bet. You increase the probability that you're not going to be significantly impacted if you're vaccinated. Only the Department of Health or the hospitals can tell you out of the people who died, how many of them were vaccinated or unvaccinated, how many of them had pre-existing conditions. But there are people today in our hospitals here who are in intensive care units. They're critically ill, and we know that when they end up on ventilators, a certain percentage of them are likely going to die. So it's still a serious thing, and the question is, which one are you? Which human being are you going to be in? You don't want to get it in either case. So that's what I would say. Okay. All right.
Laura Greenberg, Fox 35. This question is for Dr. Jenkins. Just talking a little bit more about the absentee issues within the district. My understanding is the district doesn't keep track of why a student might be out sick, whether it's for quarantine or home voluntarily because of COVID concerns. Is that something that you guys have tried to keep track of in the past? Is that something you're concerned that families were or are taking advantage of?
So two-part answer. One, I'm not so much concerned that parents would be taking advantage of it because we're able to track whether or not they're staying up with their assignments. And so if you're at home sick or being voluntarily quarantined by a parent during the month of January, as long as you were in touch with the school and completing your assignments, then we were not concerned. It's those students who were actually truant in January, if they weren't turning in assignments, the school couldn't reach anyone, they couldn't get in touch with them. Those are the students that we had to pursue, and there have been a couple of truancy cases pursued that actually have gone to court. But for those parents who are being very responsible and in communication with the school and getting assignments completed, those were considered excused assignments in January.
Troy Campbell with Channel 6. This question is for Comptroller Diamond. What do you think is going to be key to stabilize the TDT numbers when we have had record amounts of money we're pulling out of reserves in a 12-month period, while also reporting in that same period a record amount even pre-pandemic of revenue? So going forward, how do we kind of stabilize that?
I think there's three things: COVID, COVID, COVID. It's all about the COVID numbers. And, you know, I mentioned that I've probably been here 25 times, and we've had good months, and we've had some honestly terrible months. And the reason is the COVID numbers. When COVID goes away, the tourists will come here. When COVID comes here, the tourists won't come here. And we saw that in April of 2020 when the major theme parks closed. We lost 97% of what we usually get. The reason was COVID and the shutdown. Other months when there's a COVID spike, the numbers, you know, when the COVID spikes go up, the tourism numbers go down. And when the COVID numbers go down, the tourism numbers go up. In December, there was a lot of positivity about this, and people were excited. And I think, you know, at the end of the day, I mean, Orange County is probably the world's greatest leisure tourism, probably the greatest tourism destination in the world. And people want to come here. People save up all year to take their families here, and they want to come here. And if you've got COVID, though, people are going to think twice about it. They're going to think twice about traveling. They're going to think twice about putting themselves and their loved ones at risk. and they'll defer it. They'll do it some other time. So that's the reason. It's a great question, and that's why I just think it's so important to get the COVID numbers under control and keep them under control.
Well, that was the final question. Thank you all for coming. We will stay focused on reducing the spread of COVID in our community, and we'll report out to you from time to time as we have continued to do during these last many months. Have a great weekend.